more insight, more understanding. This is Fox 23 News in Depth with Rick Marino.
1 out of every 4 Oklahomans is on Sooner Care. That's the state's version of Medicaid. And if the current version of the Big Beautiful Bill holds, big changes are coming to Oklahoma. We'll go in depth on that, but first, here's tonight's top stories. The Oklahoma State Supreme Court says the U.S. Supreme Court's McGirt decision does not apply to tax policy. The court ruled in Strobel versus Oklahoma Tax Commission that tribal citizens living on tribal land should not get a separate tax policy or be excused from certain taxes. They must pay like non-tribal Oklahomans. The governor celebrated the ruling, while the Muskogee Creek Nation says it is not in line with federal law. A new lawsuit has been filed to try to stop the state's new controversial social studies standards. Americans United for the Separation of Church and State filed the lawsuit on behalf of 33 Oklahomans. It says the state's Open Meetings Act was violated. It teaches kids lies, and it lifts up Christianity over other faiths, among other concerns. State Superintendent Ryan Walters said in a statement, quote, "These people hate America." The investigative arm of the state legislature says there were clear failures on both executive oversight and when it comes to the budgeting practices at the Oklahoma State Department of Mental Health and Substance Abuse Services. Legislative leaders say the new audit does not say how much the agency is in debt for, but they say it reaffirms their decision to fire the agency's director at the end of the last legislative session.
The Senate being evenly divided, the Vice President votes in the affirmative. The bill as amended is passed.
Tonight we're going in depth on the Big Beautiful Bill. It passed off of the Senate floor after Vice President J.D. Vance cast the deciding yes tie-breaking vote this morning. It's not a done deal yet. It goes back to the House of Representatives. But I want to offer you a perspective that we haven't heard a lot about, but many people in our state are concerned about. Take a look at these numbers. The Big Beautiful Bill deals with a lot of Medicaid reform. In Oklahoma, Medicaid is called Sooner Care. Same program, but with a local twang in the name. 1/4 of the entire population, or 25% of the state of Oklahoma, depends on Sooner Care to help pay for their medical coverage. That's more than 1 million people out of the 4 million we have total living here. These are children, the disabled, and the working poor. On top of all of that, back in June 2020, Oklahomans narrowly passed an amendment to the state constitution expanding Medicaid under the Affordable Care Act, or Obamacare. You can see this was a very close vote, and that also means when it comes to providing health care in a partnership with the federal government, Oklahoma is also locked into providing certain Sooner Care services forever or until the state takes a revote. So with all of that in mind, let's first get an update from Caroline Shively, who's in Washington. After an all-night vote-a-rama that concluded this morning, in the end, the Senate passed President Trump's Big Beautiful Bill, but by the slimmest of margins.
The bill as amended is passed.
Senate Republicans squeaked out just enough votes to pass President Trump's Big Beautiful Bill on Tuesday.
You know, I'm waiting, listening to these wonderful words, and they are music to my ears.
The measure slashes Medicaid and clean energy, increases funding for defense and immigration enforcement, and renews the 2017 tax cuts.
Any worker in clean energy industry who loses their job does not think it's beautiful. Any mom who can't feed her kid on $5 a day doesn't think it's beautiful.
The Congressional Budget Office estimates the Senate bill will add more than $3 trillion to the debt over 10 years.
These Republican senators that know this bill is a pig, no matter how much lipstick you put on it, it's going to come back to haunt them.
Former Doge head Elon Musk calls the bill insane and says if it passes, he'll establish a third political party. Trump responded Tuesday morning.
You know what Doge is? Doge is the monster that might have to go back and eat Elon. Wouldn't that be terrible?
After the Senate, the bill goes back to the House for yet another vote. In Washington, Caroline Shively, Fox News.
3 Republicans in the U.S. Senate voted against the bill, and one was a complete surprise. North Carolina Republican Senator Tom Tillis said the entire bill complicates health care coverage for more than 600,000 people in his state, especially low-income folks. Tillis' state is like Oklahoma and expanded Medicaid. He gave a fiery speech the other day before voting no and announced he would not seek re-election.
Now, Republicans are about to make a mistake on health care and betraying a promise. It is inescapable that this bill in its current form will betray the very promise that Donald J. Trump made in the Oval Office or in the cabinet room when I was there with finance, where he said we can go after waste, fraud, and abuse on any programs.
And as you just heard the senator say, President Trump has insisted again today that the changes made to Medicaid are solely designed to cut down on waste, fraud, and abuse, and that the real people who need it will continue to be covered. With the passage of the big, beautiful bill not being finished yet, but a framework now in place, we can now clearly see that the next legislative session in Oklahoma City will have to deal with Medicaid and SNAP head on. While we still don't know what changes the U.S. House will make to the big, beautiful bill, one thing is clear. The need for a sudden special session in Oklahoma City to adapt to it is slim.
Yeah, one of the things I'm actually pushing for on the Medicaid changes is phased-in changes to give several years for states to be able to make the transition.
Oklahoma U.S. Senator James Lankford's request to give states more time to adjust to the Medicaid changes and not just have them suddenly kick in was granted. And in the middle of around 900 pages of text are the clear words that should the bill pass, state lawmakers have until New Year's Eve 2026 to have a plan in place on how they will start to deal with changes to Medicaid and Supplemental Nutrition Assistance Program, or SNAP, starting January 1st, 2027, with some changes coming later.
We all know with the Affordable Care Act, when that was passed under President Obama, they gave 90% federal funding to healthy adults and gave 60% funding to disabled children. We've always thought that was a foolish way to be able to design that.
Inside the big bill are new work requirements for able-bodied adults trying to access both SNAP and Medicaid. Requirements Oklahoma U.S. Senator Markwayne Mullins says will crack down on fraud, not those who have legitimate needs.
The people that we're focusing on are the ones that are frauding the system, and those that are those that should never have been accepted into the benefit programs to begin with.
25% of Oklahoma's total population relies on Medicaid under Sooner Care, and the Department of Human Services reported recently more than $1.5 billion of SNAP benefits were used in Oklahoma grocery stores to buy food just within the last year. Rural hospitals across the state have also voiced concerns about shifting or reducing services because their funding could be reduced. And the reforms coming down is a clear sign that the federal government is going to require states like Oklahoma that expanded Medicaid to pick up more of the tab.
Because that's a large amount of money, and you know, our budget's not as big as the federal budget, and so it could really hurt Oklahoma.
Last month, I interviewed Oklahoma Senate Health and Human Services Chairman, Republican Paul Racino, who is watching the bill. He said a tax increase was out of the question, but the state will have to figure out how to cover the extra costs soon to be put on its shoulders.
We have a large contingent of people that rely on Medicaid services, and if we remove those services, there will be a lot of people hurt by that.
Now, tonight we just focused on Medicaid and SNAP and the poorest among us. There are exciting things in the big, beautiful bill as well. I can tell you I'm very thrilled about the no tax on overtime, and any waitress and waiter you run into is thrilled about the no tax on tips. But when it comes to the working poor, children, and the disabled, should the current form of the bill hold, next year will likely be life-changing for many who depend on that program that helps them care for themselves. And it will soon fall to the people we sent to Oklahoma City to figure out a new path forward. Something to also keep in mind, state lawmakers just put us on a path to 0% income tax, but only if certain benchmarks in the state budget are met. Now they have this new multi-million-dollar added expense likely headed their way.